This video is for educational and informational purposes only. The content is based on personal experiences and is not medical advice. Always consult a qualified healthcare professional for personalized medical guidance.
The future is this. What I just told you is the future. And we're going to, maybe not me, but others will perfect it to the point where cancer will not be considered a fearful disease. People will start getting healthy when you're killing their cancer cells, not making them worse. Hair fallout, what are you talking about? Anytime you've seen these cancer people, they're always bald, right? That we're treated by somebody who has no clue about the biology of cancer. You should never be bald. Why are you bald? The cancer cells don't exist in your hair follicles. It's the adverse off-target effects of the poisons that they're giving people, radiation and poison. Your hair goes. Why are you doing that? The damn cells can't live without glucose and glutamine. It can't transition to ketones and fatty acids. Now you know how to kill them and manage the disease, and you don't have to lose your hair or the bleeding gums and diarrhea, fatigue, nausea, vomiting, all this kind of crazy stuff. You don't have to have that. Go down to talk to your oncologist. Go to the top medical schools. What I said to you, they have never heard of it. I have no clue. Most of them. Look at it. They tell Infamil. They go. Many cancer patients are told, eat whatever you want. Glucose has nothing to do with cancer. Get your fat, get your sugar up. This is nuts. I mean, these guys, don't they know anything? Don't they read the scientific literature? Don't they understand the biology? This is the scary thing. It's scary to know that someone who's treating you has less knowledge of the disease than the patient. I know, I hate to say this stuff. I mean, it makes me, I look at the science and I know what I'm talking about. And I feel like when I see this, I'm saying, oh my God, this is so tragic on every level. Yeah, I mean that's pretty much what it is. Now we're the tip of the spear on this whole thing, and it has to be perfected. It has to be dosage, timing, and scheduling are the ways to perfect this. And this is what we call non-sexy science. This is mostly trial and error. So people don't like science. Oh wow, you got some innovative. We got 1,700 people a day dying that we can significantly reduce, but it's not sexy science. It's trial and error on how to target glucose and glutamine without harming the rest of the body. And you can do lower glucose with diet, but you can't do that with glutamine. So you have to use drugs. And what are these drugs? Well, they're glutamine targeting drugs. They block the ability of glutamine to be metabolized. And if you don't know how to do that the right way with the right dosage, you could not make it work as effectively as it should be. So we have to hold the noose on glucose, which people can do that. That's why we developed the glucose ketone index calculator to allow people to know that you can bring your blood sugar down and elevate your ketones and get into this nice low zone. And then you come in and you target the glutamine while you have the patient in a low GKI. And that requires some skill because targeting glutamine, you have to be very delicate. It keeps our gut healthy and it keeps our immune system healthy. A urea cycle. So glutamine is an extremely important molecule. If you don't know how to manage it, then you could potentially not have this therapeutic strategy work as successful as it should be. And I don't know. They all say, "What do I have to eat for Craig?" Well, I don't know what they're all based on this. Bring your GKI down, and then we come in with drugs to target glutamine. It has nothing to do with glutamine in the diet. Zero to do with glutamine in the diet. So it has to do with targeting glutamine with drugs, and you have to do that strategically. Otherwise, it won't work as well. So people say, well, oh yeah, don't eat carbohydrates. Bring your sugar. Do water-only fasting. It's easier to get into these zones on carnivore than it is on vegan. So you have to be chewing plants all day long like some herbivore. But you got to be careful because you got to get your GKI down. You can do it if you eat plants, but it's just harder. I don't know. People can do whatever they want to do. Want to stay alive, they better understand what I'm talking about. Because a lot of the treatment falls on the shoulders of the patient. So the patient has to be knowledgeable and compliant with the knowledge. Otherwise, it doesn't work. People tell me, "Oh, I can't do this." I'm like, "Okay, go get radiated and poisoned. See how that works." Yeah, it's the most abundant amino acid in the body. It's very high. and it's needed for our immune system. So if you go in and shut down glutamine completely, you damage your gut and you prevent your immune system from picking up the dead tumor cells. Who's going to pick up the dead cells, right? So you go in and you slaughter a population of cells, and you got them laying around. It's like a battlefield. You want to let them all rot there, you bury them, right? So you have, and that's done by our immune system, and they need glutamine. So the glutamine that the cancer cell needs is the same glutamine that the immune cell needs. And as we've shown, all these metastatic cancers are derived from our immune system, especially macrophages. So we know what the metastatic cancer is, regardless of whether it's a liver, a colon, a breast, a brain. All these metastatic cancer, all these metastatic are compromised macrophages, also dependent on glutamine. So my adversary needs glutamine, and my therapeutic cells need glutamine. So you can't go in there. Okay, you can kill cancer cells, but then you prevent your immune system from picking up the corpses. So you have to be strategic. So what we found is that if we hit them with glutamine for a day, what happens? The tumor cells get hammered and die, but the immune system doesn't die; it just gets paralyzed. It can't. So you pull off the glutamine, let the immune system now recover, picking up the dead cancer cells. So again, it's you slowly degrade, while your body is getting healthier and healthier and healthier, burning ketones and fatty acids, your normal cells. But the tumor cells are restricted. They can't use these tremendously powerful, effective alternative fuels, fatty acids and ketone bodies. So we know the biology of what we can do. The future is this. What I just told you is the future. And we're going to, maybe not me, but others will perfect it to the point where cancer will not be considered a fearful disease. But we have people will start getting healthy when you're killing their cancer cells, not making them worse. Hair fallout. What are you talking about? Anytime you've seen these cancer people, they're always bald, right? That's be, that we're treated by somebody who has no clue about the biology of cancer. You should never be bald. Why are you bald? The cancer cells don't exist in your hair follicles. It's the adverse off-target effects of the poisons that they're giving people, radiation and poison. Your hair goes. Why are you doing that? The damn cells can't live without glucose and glutamine. It can't transition to ketones and fatty acids. Now you know how to kill them and manage the disease, and you don't have to lose your hair. So, or the bleeding gums and diarrhea, fatigue, nausea, vomiting, all this kind of crazy stuff. You don't have to have that. But yet, go down to talk to your oncologist, go to the top medical schools. What I said to you, they have never heard of it. They have no clue, most of them. Well, hyperbaric oxygen therapy, as Dominic, he's an expert on that, the Agostino. We published together, and it turns out that putting a patient in pressured oxygen dissolves oxygen. You have to realize our erythrocytes carry oxygen, and they could be 100% saturated with oxygen, but the oxygen is not dissolved in the plasma. That happens when you put the patient in high pressure with oxygen. And if you have a tumor cells with bad mitochondria or inefficient, corrupted mitochondria, and you put force oxygen onto them, they produce more reactive oxygen species, ROS, and that kills them. And the interesting thing is that what protects them from ROS damage? Listen carefully. What protects the cancer cell from ROS damage is the glucose and glutamine, because the glucose carbons are part of the pentose pathway, and the glutamine produces glutamate, which is part of the glutathione mechanism, the two antioxidant systems. So when I'm putting a patient in restricted glucose and glutamine and putting them in hyperbaric oxygen, I am making those tumor cells extremely vulnerable to oxidative damage. It's almost like radiation without the toxic effects, because radiation kills tumor cells by creating reactive oxygen species, ROS. But why would you do radiation? It harms your normal cells when you can do this with regular. So we can take patients, put them in a low glucose ketone index, and then put them in oxygen pressure, and that can also help kill tumor cells without toxicity. Well, as I said, if you ask anybody about the glutamine issue in the metabolism field, they're going to say, "Oh yeah, everybody knows about glutamine. The tumor cells are glutamine addicted." But what I said to you is that they think glutamine is respired, part of the respiration. Anaplerotic means the replenishment of carbons to the TCA cycle. Uh, our discovery was no, it's producing energy through mitochondrial substrate level phosphorylation, a different mechanism from oxidative phosphorylation. So people people are know that glutamine is important for cancer, but they didn't know the mechanism. We're showing you that it's a fermentation mechanism. It's another aerobic fermentation mechanism that's producing energy through a different strategy. So you have to simultaneously target glutamine and glucose together to get therapeutic benefit. Because if you target glutamine alone, the cells will survive on glucose. And if you target glucose alone, the cells will survive on glutamine. So you got to get them both together at the same time while the patient is in nutritional ketosis. And then you put a much greater chance of eliminating the tumor. And even if you don't eliminate it, they become very indolent. They're not angry. There's a lot less inflammation and a lot less angiogenesis and all these other aspects of an angry tumor, inflamed. We reduce a lot of that. So we have some cancer patients that um, were considered terminal, but they're not cured, but they're living with it. So everybody wants cure, cure, cure. I'm not. Listen, get it managed, man. Manage the damn thing, so your quality of life and overall survival can be improved. Whether you're cured or not, who knows? But the bottom line is you're living longer with a higher quality of life. What's wrong with that? Right? Nothing wrong with that. So that's what we're working on. We're not working on a cure. We're working on effective management. And if you get a cure, good, that's great. But if not, then you still can be living longer with a higher quality of life. Well, certainly earlier stages would work much, much better. Um, some people email me from hospice, and they've got like 2 days left, and I'm not sure whether their bodies can sustain the stress, metabolic stress. In our preclinical, we're actually testing that right now. We take mice and we give them tumors, and we let the tumors grow really big and angry, um, where the mice start to suffer, just like a human would be suffering. And then we try to come in with our metabolic therapy. And it's actually astonishing. Some of these mice that might have only had a couple of days to live really start to recover better. So I don't know at what stage it becomes no longer effective, but we're testing that. That's what we do. Uh, you see so many papers in the scientific literature where they put a few cells under the skin of the mouse, and like 24 hours later, they start a very aggressive treatment. And then you all of a sudden see, wow, look how effective this is. Let that tumor grow really, really big and angry and metastatic, and then try your therapy and see if you can pull the mouse out of it. That's what we do, because if we're successful in doing that, man, we'll have tremendous success in the clinic, knowing how to do that. So we stack the deck against us. We want the hardiest, strongest tumors, and we want to see if metabolic therapy can work against the most aggressive and angry tumors. Now, of course, in the human clinics, they have these stage zero cancers. A lot of them are called stage zeros. And they do, some women getting mastectomies and radiation on stage zeros. Are you kidding me? Yeah, metabolic therapy will take care of those things real quick. I don't know what you're doing. Why are you just taking these beautiful women and cutting their breasts off, surgically mutilating? I mean, it makes no sense to me at all. I don't know what these people are doing. Don't they read the scientific literature? Don't they understand what we're talking about here? It's just sad. It's really a tragedy. Well, I think that's what we expect to do too. We're not arguing against, and as a matter of fact, what we're finding, if you do metabolic therapy, it has two things. Number one, it gets smaller and can be plucked out really easy with a surgical procedure, or it disappears altogether. So why you want to take someone's breast off if you can't find anything that you were looking at, right? Prophylactic? Are you kidding me? I mean, unless some women like don't like their breasts and just want them removed. I don't know what the logic is behind this. But any event, yeah. So The idea is that yes, we can, and the other thing too, we're not against all standards of care. What we're finding is that sometimes chemotherapy in very small dosages has so much more therapeutic efficacy when the patient is in nutritional ketosis. So we don't throw out all the tools of the toolbox. Even radiation, if it's a hard to get tumor with surgery, and radiation could do it better, you would shrink the tumor down using metabolic therapy and then come in and incinerate it with a beam of radiation and making minimal damage to surrounding tissues. So again, it's going to have to be a complete reevaluation of the kinds of tools and procedures that we're using to get a more successful outcome in managing the disease and keeping people alive. It's all possible. It's just that I don't know what it is. The field just oncology seems to be, I don't know, they're kind of strange. They can't seem to accept anything than what other than what they do and what they were trained to do. But, I don't know how long it's going to take for them to come to know. I mean, I just don't know. They're waking up a little bit, but I get so many people, what should I eat to reduce glutamine? Wrong. You can't do anything. You got to use drugs. Drugs, drugs, drugs. And one of the drugs we use is the embendazole, fenbendazole, parasite medications, and they target the same pathways that the tumor cells use. So that's why they work, but they work much better in therapeutic ketosis. Everything works better when you're in therapeutic ketosis. So don't tell me anything until you're in therapeutic ketosis. Then once you're in there, then you have a lot of options. You can go to your oncologist and tell him just use one third, and then he says, "Oh, I can't do that. The system tells me." No, it doesn't. You got to tell these guys. See, when I go to the doctor, I usually tell him exactly what I need to have done. When you ask him to figure out what you have, you could be a bit might not. Make sure you know what you have before you go to these guys and say, just do this for me, okay? Um, but yeah, the oncologists, they're trained to do what they do, and unfortunately, they're all of them, or the majority of them, are not trained appropriately. They think cancer is a genetic disease, and they just treat you with very toxic poisons and radiation and this kind of stuff. And I think their success would be much better if they knew cancer was a mitochondrial metabolic disease, and then they would use their radiation, chemo, and other procedures. Even immunotherapies could potentially work better. So everything will work better when you're in nutritional ketosis. Your body is stronger, the tumor is weaker, and whatever you're throwing at is going to work better. So all of these things come together. I don't know. It should be. It should be the number one drug. They said it was too toxic. And then when we looked up the toxicity, it wasn't anything near like Red Devil, carboplatin, and then these other things. Are you kidding me? It's nothing, has nothing like those. Um, it's a repurposed drugs. It wasn't as effective. It was working pretty good against leukemia in kids. Don't forget they used it on children and they used it on, but they said, oh, it's a little toxic and it doesn't work well. Yeah, you didn't choke the glucose. You didn't get the glucose. The problem is if when you think cancer is a genetic disease, I don't know. It's like something happens to your brain. It be, you can't think. You can't use rational thinking anymore. But it'll change. It has to change because people want to live. I think people want to live. They don't want to die, you know. So they have to come to know this, and the people will make the decisions once they see the outcome. We're publishing individual case reports. We're publishing preclinical studies. I'm seeing more and more. We're getting a registry now of all these stage 4 terminal cancer patients that outlive their prognosis. So we're collecting more and more data. At some point, there's going to be a tipping point when the population says, "I want metabolic therapy. I want metabolic therapy. If you can't give it to me, I'm going to find somebody who can." So these guys better get on board or get out of the way because it's coming. Yeah, well, I mean, that's why I said it's not perfected yet, but what we're seeing tells us there's great hope. Whenever you have anything new, uh, it's has to, all the different follow-ups to this will make the whole situation better. It is based on the science. The science tells us this is a mitochondrial metabolic disease, and we have defined the fuels driving the dysregulated growth. So now it becomes important to perfect this. How are we going to target those two fuels together and keep the body super healthy? while you're targeting this. And this is going to be the new field. This is the new form of medicine. And not only that, it works, like we saw for some of the cancer patients, um, not only does their cancer become more manageable, but they've also got rid of their diabetes and their high blood pressure and their hypertension. This all goes away along with the cancer. So clearly, it has implications for just overall general health. Because when you take people today, you've seen it so many times. A person says, "Oh, I just came back from I had a little pain, a little blood, or a little something, and now they tell me I have a stage 4 cancer." And the guy looks pretty healthy. Then as soon as he undergoes treatment, I mean, he looks like some skeleton, beat up, horrible looking. He's sick. He's miserable. This shouldn't have to happen. This is nuts. So, but yet I feel so bad for the cancer patients. They hear what I say, they get all fired up and excited, and then they go to the oncologist and says, "Oh no, sugar and diet have nothing to do with it. Glucose and glutamine, no, nothing." And then they get angry and throw you out of the office. Now, how do you think that makes the patient feel? The oncologist should be thrown out of the office and have somebody in there has a few functional brain cells, about what's going on. So I feel bad for the oncologists too. They just haven't been trained. I think they really are good meaning people. They just locked into a failed system, and it's also very profitable. So the status quo is profitable for all these different industries. But if people want to live, you're going to have to change the status quo. It's going to have to change. Yeah, it works really well for some people. And nothing works well for everybody. Let's be honest. I mean, if standards of care are killing 50% of the people that are being treated, that ain't working really well either. Metabolic therapy can work well. Is it always guaranteed to work well when you try to reduce and manipulate these things? Not always, because the same issues we have: compliance of the patient, knowledge of the patient. You see, the difference between standards of care today and metabolic therapy is that the patient has to be knowledgeable and very understanding of what's being done, because a lot of the success falls on the shoulders of the patient. In the current standard of the care, the patient is a bystander. They just sit there and get treated. They're not really participating actively in the management of their disease. They have a scheduled radiation, they have a scheduled chemo, and they just take the radiation and take the chemo, but they're not doing anything. And then they say, eat whatever you want. Make sure you get a lot of high carbohydrate foods to make your strength back. I mean, this is insane. This is lack of knowledge of on the grand scale, a complete misunderstanding of what the nature of the disease is, and a failure to understand biology. So this is the problem for the poor patient. I mean, I visited really top-notch oncology centers, and I see in the room, I see a guy, and a lot of these oncology, they're clean, white, smiling faces, and on one side, and then people being infused and poisoned on the other side. I mean, you see a guy being infused with chemotherapy while he has a big Coca-Cola and a hamburger in front of him. I mean, it's nuts. It's nuts. So what are you going to do about that? You have to educate people and let them know this is crazy. You don't do stupid stuff like that, you know? So, but anyway, they do it, and it's being done all the time as we speak right now. And as when we finish, 70 people will be dead from cancer. Can you believe this? 70 people an hour are dying from cancer in this country. And it's a horrific death for the most part, not a pleasant death. And it's sad, and it shouldn't have to be this way. Look at it. They tell Infamil, they go, all these many cancer patients are told, eat whatever you want. Glucose has nothing to do with cancer. Get your fat, get your sugar up. This is nuts. I mean, these guys, don't they know anything? Don't they read the scientific literature? Don't they understand the biology? This is the scary thing. It's scary to know that someone who's treating you has less knowledge of the disease than the patient. Or the patient, both the blind leading the blind on this whole thing. And I know I hate to say this stuff. I mean, it makes me, but geez, I look at the science and I know what I'm talking about. And I feel like when I see this, I'm saying, oh my God, this is so tragic on every level. They ignore it. I mean, I don't know what's going on with those guys. I mean, I've told them. I said, "What's going on? Who's the guys writing these uh, web pages? Don't they know what they're doing, or they're being told by some?" I don't. I think that they follow the so-called leaders in the field. And the leaders in the field think cancer is a genetic disease. So when the leaders have no clue, then the NIH, the National Cancer Institute, has no clue. So, and yeah, I mean, and why would they choose to refute? Oh, it hasn't been repeated. Well, one of the correct things, why don't you guys repeat it and see what's going on? The new NIH director wants a lot of the science to be repeated because half the stuff coming out of the cancer field can't be repeated anyway. And the tragedy is a lot of the basic research is done by thinking cancer is a genetic disease, and a lot of that can't even be repeated. So that's another. It's called broken science. Broken science can't repeat what the other guy did, and consequently, there's no advance. And when you constantly keep saying cancer's a gene, let's target that gene, let's look at the expression profile, let's look at this and look at that. Listen, we can look at that later. Let's drop the death rate now, which we can do. Once we keep the death rate down, 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 you can study all this other stuff. But why are we wasting our time on things that aren't working when we have an opportunity to reduce the death rate? Let's get the people let's get this disease under control, and then we can worry about minutia. Right now, we're putting all our energy into minutia while all these poor people are suffering and dying. So we got everything backwards on this whole cancer thing.